The Nepean Blue Mountains Local Hospital District is unique in that we have a wide variety of hospital settings. So we have the big specialist centre, the tertiary referral hospital, Nepean Hospital, and then we have a number of hospitals in the region, in the district, Springwood, Lithgow, Blue Mountains. And there is a huge need here in the area to support patients by bringing patients and the doctors looking after them in contact with the best specialists in the field. And that's how we got the idea of the Nepean Telehealth Technology Centre. The Honourable Gillian Skinner, the Minister for Health, saw that this need was there and believed in the idea and invested $2 million to get the Nepean Telehealth Technology Centre started.
Nepean Outreach Service, or NOS, provides care to patients in their own home. The mobile nurses are required to drive to each patient's home, and each nurse will visit 5 to 10 patients every day. At times, when the NOS nurse visits the patient's home, the patient's condition has changed, and the nurse may be uncertain about treatment. The nurse, through telehealth, can consult a doctor back at the outreach clinic of Nepean Hospital.
Hello.
Let me get in the right position. Hello.
How you going?
I'm well.
Good. I was hoping to speak to you about Mr. Power.
We just want to get the wound results from his swab that I took a couple of days ago.
This new system that's been developed allows information to be shared between the mobile nurses and the outreach staff.
Now the drain came out a couple of days ago.
So now we've just been putting a dry dressing over it.
The outreach app has the ability to record patients' notes, to take photos and to video conference. All of the photos taken for a particular patient are stored and made accessible for the outreach clinical staff. The clinical staff can clearly see how the wound has progressed over time.
We're in luck. The bug is sensitive to Keflex, so we can continue using that.
Okay.
How is he himself? Is he well? Does he have a fever?
I'd like to talk to the patient.
Hello, Mr. Power. My name's David. I don't think we've met.
No.
How have you been feeling since the operation?
No, I've been well. I've been well in myself. Talking to the doctor is a fantastic arrangement, isn't it, with the tablet and having that ability to do that so easily and without having to even go to the hospital.
So there's only so much you can write in a description of the wound, but when you have that visual aspect, you know, it's easy to say, okay, this dressing is working, let's continue with this, or this wound doesn't look like it's changing or it looks worse, let's, you know, try something different.
Okay. Do you have any questions of me?
No, thank you.
Okay.
No, I'd just like to say how wonderful all the treatment has been.
Well, that's very kind of you to say. Not
at all. It's only because it's true.
Sometimes patients have trouble getting to the clinic, so I think it's really good that you have that instant contact with the doctors.
I think it's really exciting, not only because it has a research slant to it, so you know, any lessons we learn from this will be published and will be disseminated to other practitioners. So I think leading a project and seeing new developments come into clinical practice is always exciting and very gratifying.
It's very confirming for the nurses who are, you know, doing the consultation in the person's home to be able to do a callback and actually show via the device to the doctor who's back in the hospital to get the doctor's advice as to how to proceed. You know, wonderful applications of technology.
There are 27 residential aged care facilities in the Nepean Blue Mountains catchment area, with over 2,100 residential aged care places. Some of these facilities are located in rural areas and therefore make hospital travel a major barrier for patients to receive treatment.
The problem is we ring the ambulance. We don't have a lot of transport out here anyway, and the families are, it's very difficult for them to get them to the hospital. So we ring the ambulance, we wait an hour, 2 hours, because it's not, particularly if it's non-urgent. They go to the hospital, they wait in triage in emergency for, 5-6 hours before they even get seen by a doctor. 9 out of 10 times it's for an antibiotic or, have a wound assessed or what have you, and they might get back here at 10 o'clock at night.
Some of the challenges that exist are the fact that they come back from hospital at any time of day or afternoon or sometimes evening. They may come back and we don't really know what's happened to them while they've been in hospital. The notes may not come back with them straight away and they get faxed later. So we really don't know a lot about what's happened while they've been in hospital. Telehealth is a great new project initiative that has been run by Nepean Hospital, and it actually brings doctor's appointments to the home, to the facility. So where we have residents come back from hospital, they often have a post-hospital appointment that they need to attend, but rather than having to organise ambulances to take them to the hospital for the appointment and wait around all day for transport back to the facility, the aim of the Telehealth project is to bring the appointment to them.
It's been working very well. We have piloted at 2 sites, and it's going well. We've seen about 20 patients so far. So we'll have it for another 3 months before we come and make recommendations.
Right now, yep, our plan, and you need to keep it with her notes. Yep. All right. Okay.
During the consultation, we can actually, direct the questions, any problems that we have concerns, since they've come back immediately to the team that's directly involved with the care while she was at the hospital. There's pretty much no chasing around, who's looking after her or he when he was there. So that's fantastic, and it just helps the overall care of the resident.
So this way we can actually talk to the doctors over the web, and then we get opinion and see whether they are actually a good candidate to go to the hospital, if there's further investigation should be done or any diagnostic tests should be done. I only send people to hospital where I think that they do need further investigation. If I'm able to keep them in the facility, I'm happy to, but I'd like to get some second opinion, which is very easy via the web.
It's excellent. We're really excited to be a pilot, to pilot the telehealth, because for us, as I said, isolation is a big thing for us. So
it is positive. It's not just positive from a staff perspective where we have more involvement with the consultation process, but it's certainly a fantastic benefit and a great improvement for our residents and the care that we provide them. It just gives them a greater quality of life, and I think it's fantastic for them.
Some dialysis patients are treated at hospital, but others choose to stay at home. Western Renal Services are one of the largest in Australia. Each patient records information of their dialysis sessions in a logbook. This large amount of handwritten information can be cumbersome, making it difficult for the specialist or the nurse to identify trends.
But it's really cumbersome. They could be ringing me and talking about numbers. It's hard for me to envisage, to visualize the whole scenario.
Our Nepean Home Dialysis app is designed for home dialysis patients to record their information electronically and to assist in calculating goals. As the patient record grows, the app shows the trend in a graph.
Whereas if they enter it into an applications, the treatment data that they enter are reflected in my computer in real time. So if they're having some concerns or questions, they can just ring me and say, hey, can you open up your screen and look at my treatment data? You are aiming for a dry weight of 7 to 8.5. And you are doing 5 to 6 hours. It actually gives me about 4 weeks in one screen, 4 weeks worth of treatment. It also computes the average weight gain of a patient, the average blood pressure over the 4 weeks. So it gives me an indication on whether this patient is fluid overloaded or dehydrated.
I think it's a lot better because when I have my appointment with a specialist, instead of carrying the book with me, my phone is in my pocket. It just show the doctor instantly. And the other advantage is the nurses in the center, they can view it. They can have like a graph as well, a graphic. They know what's occurring, whether I'm doing the right thing, whether I'm taking too much fluid out in too short period of time or things like that. And they can monitor my blood pressure as well. They can tell me if something is going wrong.
I used to see patients in the clinic where patients would come in with an exercise book, 3 or 4 pages of data on the treatment that they've done at home over 2 months or 3 months. And I just didn't have a clue as to what I could do with that data. So I decided that there could be a better way to look at dialysis parameters. We could get rid of the variability in pre and post dialysis weights and blood pressures and flow rates, and kind of map them in an app. The future is great. I think we can do a lot with patients at home, and we sitting in our offices and clinics, and do things that are more efficient and that promote patient independence.
Worldwide, stroke is the second leading cause of death, responsible for 9% of the total deaths each year. For a stroke patient, time is critical. Receiving medication to reverse the effects of a stroke can make a significant difference to the patient outcome. The decision to thrombolysis must be decided within 4.5 hours of the onset of symptoms. Telehealth provides a neurology specialist with the ability to view and assess the patient remotely. Therefore, these patients will have access to timely specialist consultations 24 hours a day.
The left-sided weakness, the time of onset was roughly around 1 hour ago. And so I'll do the stroke assessment on him, okay?
Sure,
and let you know what else you would like me to do. All right.
Thank you.
So, Taichi, just look at my finger here and follow my
With
finger
the
with your eyes.
high-definition camera, the doctor can look and talk with the patient and conduct a neurological examination. The doctor can even see the patient's eye movements.
It is a win-win situation. I think the first and foremost is to patient. By appropriate patient selection, we are hoping to reduce the complication rate, and also hopefully we can reduce that with time, which is a major stumbling block now to initiate the treatment.
The specialist can remotely diagnose the patient's condition and direct the treatment for a stroke patient. The medical staff at the patient's site carry out that treatment, which may include thrombolysis.
All right. So he's got a left-sided homonymous hemianopia. All right.
Ashish, you said he's 40 years old, so
Yes.
he's quite young. Does he have a headache at all?
That's the thing I've earlier mentioned, reducing the door to needle time. It is good evidence that if we reduce that thrombal at the time so that we can do the early thrombolysis, that eventually going to reduce the disability associated with the stroke, and subsequently less time spend in hospital, will reduce the length of stay in hospital, and the rehabilitation outcomes will be much better too. So I can see there will be a good outcome overall. So it's a win-win situation, as I said earlier.
Okay. The ECG is okay as well?
Yep, ECG is normal sinus rhythm at the heart rate of around 70.
Okay, good. Let me know if you have any issues.
Will do. Thank you very much.
And there's no need for IVC or any treatment session?
No worries. Okay, thank you.
There are quite a few other projects that we are running here with the Telehealth unit at the moment. One of those is the High Risk Obstetrics Outpatients Clinic, and this is championed by Professor Peake. And the idea of this is to avoid travel for these high-risk obstetric patients down to Nepean and have some of these consultations happen using telehealth. The Paediatric Allied Health Electronic Directory is an app that was developed. It was championed by Professor Ralph Nannan and Dr. Anthony Liu with a purpose to provide a directory with specific allied health services. So clinicians or families can look up their local allied health services and look at the diagnosis of the patient or the age of the patient. We're working with the National Health Direct at the moment as well to help further populate the app, and it's available now for download. One of the other projects that we're working on at the moment is telepsychiatry, and this is to provide access to patients in the emergency departments at Lithgow and Blue Mountains Hospital who require a mental health review, the access down here at Nepean Hospital with a specialist. We're at the early stages of developing this, but we're hoping to have it up and running by Christmas this year, and this will help the emergency departments meet their NEAT targets so that the patients aren't waiting in their emergency departments for hours on end. Another one of our projects is focusing on the orthopaedic patients who are in Lithgow and Blue Mountains Hospital. At the moment they have to travel down to Nepean for an outpatient consultation, and sometimes they're only here for a very short time.
So we have quite a few patients come to us from Nepean Hospital after orthopaedic surgery, and those patients come up here for rehab and to spend some time up here. And sometimes, you know, quite a lot of the time they're local people, and then they need to have a checkup with their orthopaedic specialist, and then currently we have to send them down by hospital transport to Nepean. So what telehealth will do is that those patients can have that consultation done through telemedicine, and that'll save the patient having to go through the transfer down to Nepean.
People who will only need a quick review, so that would be people who have already seen and know their doctor in another location but just need a quick checkup, and so it helps them not have to travel the 3.5 hours just to say hello and how you're going. And then other people, like people with mental health illness who can find themselves in a sudden crisis situation, and access to the psychiatrist will allow them to start on their pathway for treatment quicker.
It certainly is an exciting time. Telehealth is showing to be able to connect our LHD and our community back with our health professionals here at Nepean. I think it's great for the patients. The patients are the priority, and so their reduced travel or access to services, it's been a fantastic opportunity, and it will keep on growing. So we have a lot of other specialties that are interested in using telehealth. I think it's a great opportunity for Nepean Hospital and Nepean Blue Mountains LHD.
I think telehealth is much more than just audiovisual these days. It includes mobile technology, mobile apps, sensors, smart homes, well-being equipment. Also, we are looking at cloud technology, data analytics. All of that is available. And because we work with the university, we have new students, we have academic staff who are willing to participate. Everybody gets very excited when I talk about telehealth. And so I think technology, we are ready. I think Nepean Hospital, all the departments and clinicians are very keen and ready. So yeah, I think we are hitting the right combination of demand and technology.
When I look at how much we've achieved over the last 3 years, how much Jinman Kim and Tanya Baldacchino and the whole team with my co-chair Kim Scanlon have achieved in the last 3 years, I am so excited about the next 3 years. One of the key things that's going to happen is, of course, Nepean has been appointed as the only centre outside of North America as a site for research into telesurgery using the robot that we have here, the Da Vinci robot. So the future is indeed very bright, and the Nepean Telehealth Technology Centre lives on through these projects.